Thank you, thank you, thank you. I'm going to ask Shirley to join me up here. I'm just going to quickly go through a list of people that have joined us. Many of the members of the General Assembly went in. Our man Billy O is still here, Billy O'Brien. Rep Solomon, Rep Lombardi, obviously Rep Slater, Rep Morales, Rep Bennett, Rep Donovan, Tanzi, Potter, Hull, Rep Knight, Rep Felix, Rep Agello, Rep Bella Wilkinson, Rep Alzate, Rep Casimiro, Rep McGaw. We're joined by folks from the Treasurer's Office, Seth Magaziner, Rep Terry Cordovan, the AFL-CIO. We'll hear from Pat in just a minute. Obviously, Rabbi Jeff Interfaith is with us, Rep Kazarian, Rep Bide, Rep Handy, Rep Kislak, Rep Kazar, Rep Speakman, Rep Amore, and Rep Fogarty. Also, Ray and his group, Rhode Island Organizing Project, is with us, and we want to thank them for their steadfast commitment to this issue. I want to introduce Shirley, who is a rock, been campaigning on every issue for, 10 years. And she walks the walk. She doesn't just talk the talk. She's been one of the people on the doors, raising up issues of economic justice and racial justice, as Dr. King would do. She is one of the hardest working political people that we have in the union. And I'm glad to introduce Shirley from Bannister House.
I'm going to take this down because I want to make sure everybody hears what I got to say, especially these representatives and these senators. I hope you hear our words. We've been doing this for 19 months now, and now is the time to get it done. So I'm a CNA/MedTech at Bannister Center. I have been there for 17 years. And like I said, we've been at this for 19 months. And prior to the 19 months, we've been sitting down with our management team, schedulers, asking for staffing well beyond that 17 months. Like I said, I've been there 17 years, and staffing has always been an issue. Now, I'm just going to tell you a little experience that I have, not only as a frontline worker, but as a loved one that had someone in a nursing home. My mom ended up being admitted into my nursing home in March. Unfortunately, she's a diabetic. She had some foot issues. She needed rehab for 30 to 45 days. We put her in Bannister, one, because I work there, my sister works there, lots of other family members work there. And because of the pandemic, we knew that we couldn't send her somewhere else where we knew we wasn't going to be able to visit because of the restrictions. It was fine when we were there. We were able to help her, get her to the bathroom, take care of her. But when we left at 3 o'clock, why was it that my mother had to call me or my sister and say that she's been on her call light for almost 1 hour just to get help to go to the bathroom? Now, mind you, I said she had problems with her foot. So she was incapable of getting up and going to the bathroom herself. I literally had to call the nurse's station to get her help. And the first thing the nurse said to me was that they were working short. Now imagine, I work there. The people that work with me know her. My mother used to work there also. She was an activity aide. She worked there. She retired from there 12 years ago. But anyway, imagine your loved one being in a nursing home who they don't have family that work there. So I was able to get my mom the help. But imagine someone who's sitting there, who has no one there, who's been on their call light looking for help to get to that bathroom. How fair is it that they don't have enough staff to get that person to the bathroom? Would you want your loved one to go through that? No. Is that fair? Do they gotta lay in the bed and poop their pants and pee their pants and wait for someone to get there because there is not enough staffing? No. This is something that needs to be done. It's our elected officials who need to get it done. Like I said, it's been 19 months. That's much too long. And it's a pandemic now. It's even more important now to get this work done. Fortunately, my nursing home doesn't have any COVID patients, but our staff is kicking up and getting the virus, which means we're working short. So get this done, put the fire to the pants of whoever needs to hear it in there and get this done. We need it done now. We need safe staffing. We need the wages. It's a crisis. We need it now. Raise the bar now.
Raise the bar!